Welcome everyone. So this is second part with Professor Stephen Malin, and in the first part we were discussing about size prescribed to reduce the risk of type 2 diabetes, and in this part we are discussing more about chronotypes and timing of exercise. Where would you like to start, Stephen?
Yeah. Again, I appreciate being able to talk to you about this. I think an interesting question that we were grappling with a bit with exercise prescription and type 2 diabetes is some of the barriers people have to moving and getting out to exercise. And some of that really comes back to preference. Sometimes I worry just even when making recommendations or being asked what would a recommendation be, is am I always thinking of what the person would like to do and when they would like to do it? And I think that when question is important. I think there's been a lot of emphasis over the years of try to get 150 minutes to 300 minutes a week of exercise. Try to work at a moderate to high intensity exercise when you're out there. And even to say, take breaks in sedentary behavior. So targeting light physical activity, maybe 2 to 3 minutes on an hour around the workday to help combat some of the risk factors. But on levels, are we asking that question just when people should exercise? And there's been a lot of outstanding work in recent years. I think of Karen Esser and Julian Zerath as just two individuals of many great researchers asking that basic question of when. And this has been something on our minds more recently because we've begun to think about this through the lens of what's one's chronotype as maybe a way to go after that thought of when do people want to exercise? And chronotype, generally speaking, is a term some people I found aren't familiar with. But if I say, are you an early bird or night owl? Most people are like, oh, I know what I am, or that's easy. But that's your chronotype, essentially. That's what we're getting after. It's really one's preference towards performing daily acts of living. So this includes going to bed and waking up. So if you like going to bed early and waking up early, you tend to be an early bird. If you prefer going to bed late and waking up late, that's more the night owl. So, to say, generally speaking, there's a percent breakdown that we understand of chronotypes. So there's 3 broad classifications. There's morning, intermediate, and evening chronotype. Now, those 3 classifications actually have 2 middle categories. So you could see a moderate morning or a moderate evening that way. But generally speaking, there's these 3, right? So the morning and the evening are the end kind of categories of that. They make up about 25% of the populations each, and the intermediate is about 50%. So that means about 50% of people are going to be intermediates. They prefer to do both, probably different times of day or different parts of the year and so forth. But the other 25% prefer morning. The other remaining 25% prefer evening. I think that's an interesting kind of outlook because it begins to, in our mind, think, okay, now that we know when people might prefer to do things, what's their physiology look like? Are there different risk profiles in these individuals? Are there any cognitive differences in these individuals? Can we understand some of that to begin to think, if we understand the pathology or physiology, I should say, really, maybe then we could start that question of when's the right time to exercise? So that's at least our thinking. And it's been really fascinating to us over the last 3 years now, conducting a variety of cross-sectional studies and comparing people who consider themselves morning, intermediate, or evening chronotype, and really trying to understand their risk profiles. Because to say there's some good evidence from epidemiological studies suggesting if you're an evening chronotype, so again, you prefer to do things later in the day, these individuals, generally speaking, have higher risk for type 2 diabetes and cardiovascular disease. And that's really interesting in many ways. And those numbers or those risk profiles are independent of weight status. So I think that's a really important point bringing up, that it may not necessarily be tied solely to body weight, that there might be something underlying in the biology that's actually promoting this risk. That said, obesity is also associated with more evening chronotypes. There may be some underlying combinations of behavior and genetics and physiology that are promoting these disease risks. And we're not really sure of that right now. But to say is one thing we know in people with type 2 diabetes is that many of these evening chronotypes, again, are prone to developing diabetes. And some of this relates back to the biology where eating patterns, for example, and movement patterns seem to differ greatly. So what we've seen in our research that is partnering with literature is that evening chronotypes tend to consume more of their foods later in the day. So what's been interesting is we have a study actually in review now, but it's suggesting in line with some literature that morning and evening chronotypes might eat the same total calories in a day, but the pattern is shifted all towards majority towards the evening time, whereas morning individuals tend to eat their larger meals earlier in the day. And we might say if it's a energy balance issue, why would that happen? And it's a challenge. We're not really sure. There's been a lot of studies looking at time restricted feeding, time of feeding, and trying to understand some of this physiology. But there is some thought that eating later in the day may disrupt normal circadian physiology, where it may alter melatonin. And melatonin is an important hormone that it not only helps us sleep and fall asleep and stay asleep, it also impacts our physiology and our glycemic control and endothelial function so that blood will flow properly to different tissues. If this is the case and eating later in the day is shifting that hormonal profile, this may be one explanation again. That said, it's not really worked out. So it's something we're really interested in. But the movement pattern, just to say, circling back to that, is that evening chronotypes tend to not move much throughout the day compared to the morning chronotype. So thinking about from the morning chronotype, these individuals tend to perform a lot of movement patterns early in the day, and that'll fade as the evening comes in as they prepare for sleep. The evening chronotype may not move as much throughout the day. And what's been interesting in our studies, we've confirmed this through using accelerometers to look at not only total physical activity, but the intensities of that activity. But what's also interesting is we've done VO2 max tests to assess their overall cardiovascular fitness. And we find that morning chronotypes tend to be more aerobically fit than evening chronotypes, despite both groups being overall considered sedentary. Just as a general proxy, these are individuals who may be taking well under 5,000 steps a day. So it's really interesting that way, just coming back to some of the behavioral pieces, because physical activity and food are both considered Zeitbergers or timekeepers and really targeting the way in which the peripheral tissues like our skeletal muscle function. And I bring that up, and the important, I think, key term there is peripheral tissues, because we have a central tissue of the brain that has the suprachiasmatic nucleus. And this one is really the central regulator for the body. So generally, this is thought to be the master clock that controls the body through the neurological system. And light is an important and potent stimulant for the brain. The peripheral tissues seem to respond quite strongly to movement and food. So I bring that up because there might be some nuances there for us to better understand in the exercise and lifestyle behavior models of how light is also interacting with the peripheral clocks and thinking about food and movement patterns. Because in some ways, the morning chronotype is going to be more exposed to that light, especially earlier on. And this may entrain then the body's circadian biology to be functioning in a different way, whereas the evening chronotype, as an example, is going to have a delayed response in that way. And their circadian biology is going to be shifted into a different profile. That means it's operating under a different way. So just saying all that, I can't help but then think of that question, going back to exercise prescription. What's the best time of day to exercise? If we think about it like this, then in my view, this may throw a wrench, so to speak, in the whole kind of approach, right? Because in some ways, I wonder, do we try to create a one-size-fits-all prescription? And I don't think it's necessarily intended that way. There's reason to say probably we have to at least start somewhere and make a general statement of, say, target 150 minutes a week. But like we talked about before, that doesn't necessarily mean it has to encompass the same exact exercise every time, the same intensities every time. and now maybe even the same time of day when people should be exercising versus even thinking light and so forth. Yeah, quite interesting.
And how would you say about the morning? Would you say that for the circadian rhythm and the body to work correctly, you should see bright light in the morning? You should drink, you should eat, move, not maybe exercise, move, that you really need to do all of those, need to wake up.
Yes, I think generally here, what I've come to appreciate is there's certainly evidence that conducting these behaviors earlier seem to be associated with lower disease risk. So I think for people then recognizing that it may be something where for intermediates and evening chronotypes, that to be a consideration if they're able to. At the same time, we just don't have tons of data to know if that's necessarily the answer and going to work. But I think for what we do know, it's a fair approach to help individuals, especially of the later chronotypes, that if indeed this is the case, maybe think about shifting a bit 15, 30 minutes earlier to begin some of those processes of entrainment.
And maybe being a devil's advocate here for the evening chronotype, could it just be that quite normal to eat potato chips, have a beer, and watch a movie in the evening? If you wake up at 6 a.m., usually don't eat the potato chips and wine or beer. So could it be just about the choices between morning and evening?
Maybe, I don't know. To your point, I think there is something to think about from a lot of the data we have, which is associated. So to your point, generally evening chronotypes would, or literature would suggest evening chronotypes have more of these profilings of consuming saltier, maybe more energy dense or fattier food choice. Some of the data we have also suggests, based on appetite profiles, that is indeed the case in eating behaviors. So we see that too. Does that mean that's causing the disease or some of these disease risks? I don't know. But I do think one could consider overall healthier food patterns. But what I'm getting at is, independent of that, what seems to be happening is the circadian biology is emerging as an area that is its own risk factor. So that doesn't mean staying up, enjoying a drink, as you say, or potato chips and watching a movie with family or loved ones or friends is bad. I don't think that's the case either, because there's an important element of socialization, communication that is beneficial to one's overall well-being. Depending on maybe the frequency and repetitiveness of that, this could be promoting what's referred to as social jet lag. Because if people are doing this throughout the week and then they're being asked to wake up early to get to work, or maybe they have to take their kids to school, what seems to be happening is that's creating a misalignment of their circadian biology, what their body wants to be doing versus what now we're looking at as society. And that mismatch is referred to as social jet lag. And this is kind of an indication of circadian misalignment. And in some ways, that's where the clock in the brain might be saying to do one thing, but the peripheral clocks are doing another. And now they're not entrained where the physiology becomes distorted. So to give you an example, just what I mean by this is it seems like at certain times of year, so we use like daylight savings as an example, we change the clocks. We manually do this. Well, these happen to be the same times of year where risk of myocardial infarction, heart attacks, car accidents, all elevate. They all increase. And this occurs across ages too, but the population most affected is actually our young adults or our teenagers and adolescents because of the changes within their own bodies. So I bring that up just to say is the circadian alignment piece seems to be a really important functionality in this whole idea. And it may be then that evening chronotypes are most susceptible to the societal demands. So I think at least in the recent years, there's been major debates in the US government on whether we should make permanent daylight savings and how will this impact society. And I think this again goes to that. There's a level where healthy eating and healthy movement patterns are important, no doubt. But we probably need to really think strongly about this idea of aligning our bodies with what they want to do versus society or daylight, and how we can better utilize that as a strategy for health.
And how do you see shift work? I think World Health Organization says that shift work is a risk for at least cardiovascular disease. I'm not sure if it was also type 2 diabetes. So that offers kind of a natural, dramatic research setting where there is definitely circadian misalignment. And then you have people who don't shift, but they work all the time in the night. How do you see what learn shift work and like for type 2 diabetes risk and misalignment?
Yeah, I think it's a really important area. And there is greater risk for people of working shifts for type 2 diabetes. So, to that point, I think this isn't perhaps a more studied area than chronotype per se, in trying to understand how do we start prescribing healthier eating patterns or different eating patterns and physical activity patterns. I think what we can learn from that is, again, the circadian alignment is very important. And this is also to say, in both cases of shift work and chronotype, something that it's not necessarily all about sleep duration. So sometimes what happens within shift work or chronotype is that people get less sleep. And that would be understandable for, say, someone working night shifts, that when they do get off, they may have to complete certain errands or tasks to support, say, overall family. And again, that may then cut into their sleep. So they would have what's on top of now a circadian misalignment issue, getting into a sleep deprived state. And this could exacerbate hormone levels like cortisol or stress hormones that could also further impair vascular health. But from a chronotype perspective, what's interesting is sleep duration is not always the issue. In fact, research studies will support that independent of sleep duration, the alignment is its own entity in promoting changes in physiology. So I think shift work is helping us gain that insight into that, the entrainment, the alignment of our biology with acts of living are maybe on par with or to a level worthy of that discussion compared to sleep itself. And I think that's a really interesting piece, because I know for at least myself, I haven't considered that as much in years. I generally have thought if you're getting your 7 to 8 hours of sleep, that's it. That's the answer. But I think what shift work is teaching us, and chronotype as well, is that, again, the circadian alignment, when we do things and what we're doing in that time could be really impactful for doing trainments of the periphery and the brain to lead to good quality of life, independent again of our sleep.
And is there a way to assess circadian misalignment? Is it only subjective, or can you see it with heart rate variability, or is there any ways to measure it?
Yeah, that's a great question. There are a few ways that I'm aware of. One common way that you might consider subjective this way is using a questionnaire known as the morning eveningness questionnaire. This is something we've used in recent years, and it helps classify the different groups. To say this questionnaire is also validated across ages. So it's something that there are slight modifications in versions if you're looking at young adults, middle-aged to older adults. But generally speaking, it seems to track well with biologic indicators. So there's two that people will often use. One is referred to looking at melatonin levels. So this is looking at delayed onset melatonin production. And this is a quite fair measure. Generally speaking, people can collect saliva and have melatonin then assessed throughout the later parts of the evening and into the next morning to understand melatonin levels. And assessing that can give a good indicator of what one's chronotype is. But body temperature is another. So assessing body temperature has been a classic hormone, or I shouldn't say hormone, excuse me, but just a physiologic parameter to marry with the hormone to then understand with the subjective measures what's occurring. To your point, like heart rate and others are certainly associated with the circadian biology and can help get some insights. But I think generally these others have been used quite broadly.
And if you are measuring heart rate variability during night, and basically it shows that the recovery during sleep is not optimal, or it's less than other nights, could you conclude that you are sleeping in the wrong time, because you said that it's not maybe about the amount of sleep, but also misalignment. Do you think the nervous state of nervous system during sleep could indicate something?
Yeah, that's a good question. And I have to preface say I don't really know, to be honest with you. Heart rate generally will go down overnight. And as we then begin to wake up, stress hormones will begin to increase. And this coincides with elevations in even blood pressure. So you will see heart rate and blood pressure start to rise just before you're waking to help excite the body, get it ready to wake up, and then continue to elevate throughout the day into the midday. So looking at the chronotypes this way, we have done some of this where we haven't measured overnight per se, but in the morning hours and measuring endothelial function, what we will see is slight shifts in their profiling. So the morning chronotypes will have a different vascular profile than intermediates going into the evening chronotypes. And we think that, to your part, is reflecting perhaps some levels of autonomic tone. So either the sympathetic nervous system is getting excited earlier in the morning chronotype, and that's helping them wake up earlier by maybe just even as 30 or 45 minutes, like our data would suggest. So this isn't necessarily 6 a.m. versus 9 a.m., more of a dramatic. This could be as short as less than an hour difference, but we will see those different vascular profiles, and they'll be higher in the mornings compared to the intermediates. And that have us believe the circadian biology is different in the intermediates to evening chronotypes, and their physiology would actually have them waking up probably later, and then we'd see that surge come about.
And talking about circadian misalignment, I think the sun went down maybe half an hour ago. It's now 5 p.m. I know that I'm pretty sensitive for the duration of the day. I'm now in Central Europe and it's beginning of December, and I feel that my circadian rhythm doesn't work perfectly. I have struggle falling asleep. I don't feel that the sleep recovers as well as other times of the year. And if I go back to Finland, which is very much in the north, circadian rhythm gets destroyed. It doesn't work. Have you looked at all the differences between the latitudes? How do you see that the misalignment can change between summer, winter, fall, and spring?
Yeah, that's a great question. No, we haven't actually done that. And that's a really good question and something we need to think deeper on. I think it can absolutely make a difference. Just as an example, here in the US with similar time frames, with a change in just clocks. It's a lot darker now, earlier than it was just a month ago at this time before shifts in daylight savings occurred. And that has major impacts on everything from mood to emotions and how those can affect our physiology, independent of circadian piece that was worthy discussion. But the change in the light, what often can happen too is you get different exposures now to the sun. So even vitamin D production can change, especially based on, to your point, of latitude. So being northern up here in New Jersey, compared to say colleagues in more of the south, like Florida of our country, very different exposures in light that way, and temperature changes too. So I'm not sure. I don't know necessarily in this way if it has more or less impacts on some of the outcomes related to diabetes, links of vitamin D and whatnot. I wouldn't be surprised if there are some changes. Certainly, this is a time of year when weight gain generally goes up. It's somewhat thought that individuals can gain about 5 pounds during winter months. And then we spend the rest of the year, essentially, between the November and January is when we gain the weight. And then we spend the rest of the months essentially losing that. But it might only be about 3 pounds. So on net averages, people might gain about 2 pounds a year. What's going on there? Could some of this be related to the changes in sunlight and exposures and then the lifestyle behaviors that are associated with it? Well,
Yeah. And I'm thinking like you could maybe look cardiovascular event and then have the latitude and compare the winter and summer months, for example. Is there more events? Because like you said, that when going to this daylight save, we can see that the heart rates, heart attacks, for example, increase. So you could maybe see, but that goes a little bit besides. Is there anything else you would like to discuss?
I think one thing I do find somewhat fascinating from a type 2 diabetes perspective this way when it comes to timing is to take a step back and just appreciate something that frankly I've learned in more recent years and really been thinking more on, which is when throughout the day is your blood glucose management perhaps more challenged? And it's interesting to point out that our glucose tolerance, our ability to handle blood glucose in the body, is actually better in the morning than it is in the afternoon and evening hours. So, in other words, it seems that for all people, independent of chronotype, as the day goes on, our body's ability to handle blood glucose declines. So, on some levels, the afternoon may be a period in which we're more insulin resistant, and our pancreas has a harder time making insulin. So there's definitely studies done on that, and they corroborate that. I bring that up because, again, if we're wondering when the best time of day to exercise would be, that might be some rationale to say, if the afternoon is when our bodies are naturally declining, maybe you'd want to exercise then to offset that, to improve those profilings. And indeed, that seems to be some of the early evidence that is emerging from various groups. So that's an interesting point to consider again. If one is able to, and they're concerned about their diabetes risk, it might be worth thinking maybe later in the day exercise could be better. And that doesn't mean exercise late evenings before sleep. Generally, not exercising, avoiding exercise about 2 hours before sleep is the recommendation. This will help minimize any disruption towards sleep, if there is any. Now, I bring that up because I think what's interesting to point out is a question you were asking me earlier about heart rate this way. What we generally know is if you were concerned about vascular risk, it seems that your vascular function is not as good necessarily in the morning hours. So it's the opposite of glucose. Vascular function tends to be lower in the morning, and as the day goes on, it gets better. And I just find this fascinating right now because if you were to say, how do I treat my diabetes? Again, we might say, going back a second ago, afternoon exercise might be better for you. But if you also have some of these vascular risk factors, maybe high blood pressure as an example, you might think, well, should I do it in the morning? And I think the real answer is we don't know right now the best time of day of exercise for treating health. But I think it goes back to our first part discussion actually here in a way, and variety might be key. Maybe instead of thinking about always exercising at just one time a day, one mode of exercise, one duration and intensity and so forth, we need to think about a variety. So maybe some days you do morning, some days you do afternoon, and these may be ways that we can try and help the system optimize its functionality and treat different comorbidities within so that we ultimate healthy lives. But it's an area of work that I think needs to be done, and we're embarking on some of that. So we're hoping to get some answers in years to come.
And when you say vascular function, mainly controlling the blood pressure, the vascular resistance, or what all do you mean with vascular function?
Yeah, I'm glad you asked that. So we've used a variety of techniques to get after this. We have measured blood pressure and heart rate as classic clinical indicators. We've also used ultrasound to measure flow-mediated dilation as an assessment to look at endothelial function. And we've done that before and after insulin infusion with a euglycemic clamp. And we've done that in efforts to better understand how insulin is directly impacting the vasculature. So a term we've been using is vascular insulin sensitivity compared to the more classic metabolic insulin sensitivity and how glucose is taken up into, say, the muscle and oxidized and used as a fuel source. What we're finding that way is vascular dysfunction from the endothelium cell using flow-mediated dilation is reduced this way in individuals who are considered to have intermediate to evening chronotypes. So the morning chronotypes tend to have a little bit of a healthier profile this way. And what's been interesting is we've also used a technique referred to as contrast enhanced ultrasound to look at capillary perfusion. And we've done this under insulin stimulation as well. And that tends to track, meaning morning chronotypes have better capillary perfusion. And what's been interesting is that mirrors the metabolic side of things. So from a chronotype perspective, it seems like there may be some nuances in that shifting pattern of individuals where the morning may have some healthier profiling than the intermediates, while at the same time still having some risk factors overall. So the circadian physiology and the vascular is an area needing more work for sure.
Yeah, I'm thinking if I remember correctly, but in the vascular function by using the blood pressure cuff, using stop and releasing, and I think the vascular function improves with. Do you remember seeing the studies?
I do. I'm aware of some of the work you're describing there with like external compulsion pressure technique.
Yeah,
These were actually some studies that were being conducted when I was also a postdoctoral fellow at the Cleveland Clinic. And it's a really impressive technique considering some individuals might be immobilized due to injury or maybe hospitalized and in various states of intensive, where these devices are placed on the legs to help move blood throughout the body. And it's been shown to be beneficial in not only blood vessel function, but also glucose tolerance and glycemic control. So if patients have amputations or other ailments that may limit one's movement patterns, certainly a good approach. For us, it's a similar technique where we do include the blood vessel for about 5 minutes, and then we release the cuff to allow blood to flow. And as the blood is flowing by, it creates the shear stress, which helps, in theory, release nitric oxide to the muscle. So it's a slightly different way in which we're using it, but yes, same concept where, instead of a therapeutic approach, we're using more as a single method.
yeah. And how do you see, like, now there's studies showing that COVID should maybe be considered more as a vascular disease than a respiratory disease. Have you seen anything in your experiments? Have you seen any anecdotal evidence with the patients? I think there's studies showing that COVID increases the risk of type 2 diabetes and also type 1 diabetes quite a bit.
Yeah, so I'm aware of some of that literature that's emerging, but to say we haven't studied it ourselves. And anecdotally, I can't say we've seen the direct effects of COVID on clinical outcomes. We've had some individuals who volunteered for our studies that have had COVID, but generally those are individuals that have had COVID 3 to 6 months prior to engaging in the study, and they haven't had long-lasting side effects. But we haven't looked at the data to see retrospectively if their physiology might differ from people who did not have COVID. But I can say that we've certainly had individuals who, through our studies, have contracted COVID. And for some individuals, it's been really interesting that you would have never known they had COVID. And then for other individuals, it's actually required them to withdraw from the study because their side effects have been so bad, they just are not able to exercise. And if they do, it really exacerbates their symptoms. So I think it's an area, to your point, that really warrants more attention because it clearly is impacting the health of individuals in ways that's limiting physical function.
Yeah. Maybe for listeners, now we have been mainly talking about exercise and type 2 diabetes risk. Older episode with David Dunstan, mainly about sedentary behavior and diabetes risk. And if I remember correctly, also Anne-Marie Koster. Maybe I don't remember correctly, but I think it was about type 2 diabetes risk also. So we have been discussing now about 40 minutes in this part. Do you want to bring some other in the discussion?
No, I think, again, I really appreciate your point bringing up just the sedentary behavior. And I think to say here maybe is some concluding remark, just movement alone is good, right? So I think on some levels for people, identifying ways to move throughout the day it's a great start if you're not doing any movement right now. This can include things just around the house, taking those breaks. Our release of David's work is exceptional in helping really point out these 8-hour work days. Taking those short temporary breaks could be good ways to combat high blood glucose, help manage blood pressure, and support overall cognitive health. I think it's something then to say if we want to begin really promoting more fitness levels and engagements in those tasks of daily living, getting out to exercise is a great thing. If you're able to go outside, get that sunlight, be a part of nature in that way, it could even add to the benefits of exercise from what we're seeing with regards to that sun exposure. But appreciating too, do it when you like to do it. Try not to always force yourself to do things. So trying to create these ways and maybe stacking behaviors together and minimize any friction that could be in your way. So laying out those exercise clothes, getting good pairs of shoes, if your feet hurt with the shoes you have now, by approaching those, you might be able to form these habits that over time begin to reap some of these metabolic benefits and vascular benefits that'll help reduce those risks of disease.
Sounds perfect. My trick is called cake run. You look a cafe in the right distance, you run there, you have a coffee and cake, and you run further, and then you take bus back home. So you actually get really far, and it's fun.
I do something similar with cycling. I will enjoy a good sticky bun in coffee.
Yeah.
So I try to do about 25 miles to this great bakery, enjoy myself, and then ride about 25 miles back so that I'm burning those calories off and using it as a fuel source.
Yeah.
But no, I agree. Appreciate that.
And that's enough of moderate to vigorous intensity activity for 3 weeks.
Yes, no.
Yeah.
And that's an important piece, right? Because it's something to say, can you have your cake and eat it too? And I think in general, you could say, sure, but this is where that appreciation for the duration of the exercise, the intensity of exercise, all those things are important to consider.
Yeah. This was really nice discussion. Thanks, Stephen.
I appreciate it again, Olli. Enjoyed this very much.